Hi, just wanted to tell you about my experience in the hospital when they removed my cancer lump. So I have triple negative breast cancer, and I went into the hospital about 3 weeks ago, and they operated and successfully removed enough margin around the cancer that made that took out all of the cancer. And they also removed 2 lymph nodes because that's the first place that it spreads to. And the results came back and they are both clear. They're cleared of, I guess, humanly detectable cancerous cells. That doesn't mean that I won't have microscopic cells floating in my body. So I'm getting chemotherapy next week, which is a scary thought, I guess, because it's going to last for a long time. It's going to last for about 6 months, and then after that I get radiotherapy. So in my last video I kind of posed a question about recovery and exercise post-surgery, and I just wanted to talk about that with you today. You know, everybody's different. So this is my experience, and by no means am I giving exercise advice or anything like that. So I also have lupus, systemic lupus, and I've had that since I was about 17, and I'm 35 now. So I've had it for a long time, and I could never exercise properly because of the fatigue and joint pain that I experienced from lupus. And so, just to give you an idea, I used to exercise for about 20 minutes, 30 minutes max, maybe twice a week. I'd do, maybe a Zumba class, and then I did a couple of yoga sessions a week, and then I'd just crash for a whole week. And then I found weight training, or strength training, whatever you want to call it. The type that I did was and is I don't know, I keep referring to it as past tense, is powerlifting, and that's really, really empowering, because for someone who couldn't even be up and awake for more than maybe 8 hours a day, it was just a revelation that I was in the gym for about 4 to 5 days a week, training for nearly 2 hours at a time, and not being exhausted and feeling rejuvenated and actually losing body fat. I lost around about 7-8% body fat, which nothing else helped with, and I didn't even correct my diet or anything at the time. It was just weight training. So I had a lot of medication-induced weight gain, and the weight training basically helped very easily, and in a feel-good way, removed some of the body fat that I carried around. So I was in the hospital for 5 days, a lot more than what I expected, because I developed a complication called a hematoma, where the blood clots around the surgery site, which is quite dangerous because the blood clots can get into the arteries and what have you, and it can be very, very dangerous. So I had to unfortunately get operated on twice. The first time for the cancer surgery, and the second time to remove the actual hematoma. My surgeon is absolutely amazing. I think they don't really normally reoperate that soon, but he got me in there the second day and removed the hematoma for me. So recovery, I have to say, I guess my experience is going to be much more different than yours, but for me it was quite traumatizing, and it was very scary, and I cried so much in the hospital, and it was really hard. It really was very hard during my stay in the hospital. But I think that one of the reasons why I recovered quite well, especially with for someone with lupus as well as breast cancer, is possibly due to my persistence in the exercises that they prescribed for post-surgery, as well as just doing my own thing as well, after I got cleared by the doctor, of course, to exercise. So in week 1, post-surgery, I did their hand and wrist and arm exercises and shoulder exercises, and I persisted every single day, and I did the 5 times or more per day, 10 to 12 reps as they prescribed. But I also did a lot of walking just around my ward, which is funny because some of the nurses got a bit I kind of kept getting in the way of everybody, so I just kept walking back and forth in the ward in my hospital gown, which possibly seemed a bit funny. So I just, the first couple of days after surgery was very hard. I'd break out into a huge sweat after walking for about 30 meters. But once I built up my strength, and it came back quite quickly, maybe because I'm young as well, I did some, I don't know if some of you who's gone through, breast cancer surgery or any surgery really, I don't know what sort of exercises you do, but I would really, really love it if you share with me in the comments what sort of things you did to help yourself recover in terms of exercise or anything like that. So I actually tried to do some half body weight half squats, and so I wouldn't go as deep as like a normal squat, but I just like hold on to the to the hospital ward walls and things, and just do squats and leg lifts and things like that with my lower body, because I thought, well, that's from my weight training, I know that that's the biggest muscle of your body, is your butt and your quads and your legs. So if you get those muscles going, the rest of it'll release growth hormones, which helps with healing. I think, okay, I'm not a scientist or a doctor or an exercise expert. So I did a lot of walking, built up my strength and my energy through the 5 days that I was there. And after the hematoma, they actually told me that I needed to move. So I was told by the head nurse, okay, you got to move once every hour. And you've got to do your exercise once every hour on the hour. Otherwise, we have to inject you with a blood thinning, I think, agent that can push out any blood clots that's left in the system. So I said, no, I don't want injections, please. I really hate them. I have terrible veins. I got jabbed about 13 times just alone for blood tests and cannulas, and I just didn't want to get injected anymore. So and that was only on the last day, but the other days I still had my cannula in my arm, in my hand, and my drain tube was, I carried my drain tube everywhere I go, which is gross. So I walked and I did the prescribed exercises every single day. I really persisted with them. I had to. And so the drain tube came out. So I stayed in the hospital for the first week. The drain tube came out the following week, and I was able to move a lot freer. But while I was in, I walked, when I got home, I walked to the post office and back, and that took maybe 25 minutes, no more. And while I was walking on the street, I did my arm raising exercises and my hand tightening exercises and my shoulder exercises and things while I was walking to the post office. And I got a few weird stares, but I knew that took priority over what I looked like to other people. And the pain kind of comes and goes. It's still coming and going after 3 weeks. But I just kept persisting, kept walking, because I really didn't want to go back into the gym before the doctor gave me the all clear. I did actually go back to the gym after the drain tube came out. So the first day that I went back to the gym, I did 10 minutes of elliptical. I think I did about 10 reps, 3 sets of the leg press, the adductor and abductor, the one that works your bum and your inner thighs. And I think that is it. That is all I did. And the weights that I did were so light that it was just the movement, basically. It wasn't really weight at all. And on the elliptical, I was actually very, very surprised that that movement actually helped with my nerves in the arm, because I'd lost feeling in my armpit and the back of my arm. And I developed lymphedema of the breast. So I was very surprised, because like once I started the elliptical, I felt like a little bit of tingling around that area, but that's about it. And I just kept on going for the 10 minutes. And the next day I woke up, that tightness was significantly reduced. That tightness and the pain subsided a whole lot, and I was really surprised by this. And I was very surprised also that the tension around the area and just the tightness and the soreness around the surgery site had actually reduced, because I thought, oh, you know, if I exercise like a week and a half, 2 weeks out of surgery, I might get a bit of pain, or if it's, you know, maybe it'll make me, it'll trigger the lupus fatigue. But it was actually the opposite, and I regained a lot more of my energy back just from that one session. Not that I'm saying that you should go and do this so soon after surgery, but it was just me, and I had been, you know, continuously exercising about 6 months prior to this. So it was basically just getting back to what I was doing, but at a much, much easier pace and a much lighter load. So week 2, I went back to the gym again, and I found that I was able to increase the level of the elliptical, and I was able to increase the time to 15 minutes now. And I did a little bit more weight in the leg press and the adductor exercises. And then I got the doctor to tell me what weight I should be doing with my upper body, and he said no more than 10 kilos. Of course, again, this is different for everyone, I'm sure. And I did my first session with the upper body just the other day, and it was actually fine by using, I think I used about 4 or 5 kilos for bicep curl, and I used 5 kilos for the overhead press, I think it's called. It's the cable machine one. And I did some chest press with the cable machine, like 5 kilos, you know, it's like the little bar. And I also did the lower body. And today I went back into the gym, and I was able to do about an hour and a half training, mainly body weight squats, really lightweight sort of stuff. And I did like 2 kilo, well, I did 2 sets of 4 kilo dumbbell bench press, and then I did it at 2 kilos for the 3rd set. And I feel, at the moment I feel very energetic, but I feel really calm. And tomorrow I'll see how I feel from today's session. But overall, I'd say that for me at least, my recovery has been really just aided and helped by the exercises that I persisted in doing. So that answers my own question from the last video. I guess my next quest would be, how will I get back to my weight training during chemotherapy? And I have no idea how my body is going to react. If you have any advice, if you have any experiences that you would like to share, please put them in the comments. I would really love to hear from you. I think it's a long video. Sorry, all my videos are kind of lengthy. I'll make another video after next week when I've had my first chemo session, and I'll let you know how I go. And I hope that I can get back into my weight training eventually. It's so empowering. It's so wonderful. It's just amazing, and I hope that you're well. And if you're not well, take each moment at a time. And if that's too hard, just take it each minute at a time. Okay, thank you for watching, and I'll see you soon.